workers across the European Union have the right to a high level of protection of their health and safety at work.
This is according to the European Pillar of Social Rights, the set of principles and rights that helps improve working and living conditions in the European Union. I'm Sasha Vakulina, and in this episode of Real Economy, we are taking a closer look at how dangerous work environment could be, what are the risks millions of Europeans are facing every day, and how to minimize and eliminate them.
One of the biggest health problems which faces workplaces across Europe and indeed the world is cancer. It accounts for over 52% of annual work-related deaths. 24% happen due to circulatory illnesses, and 2% due to injury. While cancer is a complex disease and certain causal factors are difficult to identify, it is clear that cancers caused by exposure to chemical substances in the workplace can be prevented by reducing or eliminating these exposures. In order to better protect over 40 million workers, the EU has been constantly updating the legislation to address together 26 new carcinogenic substances that have the potential to cause cancer in an organism, and mutagenic substances that can change the genetic material of an organism.
Work-related ill health and injuries are estimated to cost the EU about 476 billion euros per year. That's around 3.3% of EU GDP. The direct costs of exposure to carcinogens at work across Europe are estimated at 2.4 billion euros per year. Fanny Gorea went to see how businesses in the EU are addressing this issue.
Nearly half of Croatia is covered with forest, and some of its trees are used for high-quality material. But working with wood can be harmful. I've headed to this factory that makes parquet flooring. This wood dust, when inhaled by workers, is deposited in the nose, the throat and other airways. It can cause irritations, skin and respiratory diseases, and in case of prolonged exposure, cancer. About 3 million workers are estimated to be exposed to hardwood dust in Europe. 3 years ago, the company was taken over by a private group. They have invested in upsizing the production, using eco-friendly products, and providing a healthy workplace.
We invested into ventilation systems that are actually collecting this small sawdust, and then when the particles are collected, then they are being transported to the larger silos. Now we see what we can more improve. What substances can we reduce to an absolutely minimum, because a safer and satisfied worker is a good worker.
Here, workers benefit from adequate protection. However, in Europe, 11% of surveyed workers declare to be exposed to vapor from solvents, 15% to smoke, fumes, powder and dust, and 17% to chemical products for at least a quarter of their working time. European employers must declare carcinogens they use and the number of workers exposed to them.
However, since there are no sanctions for failing to fulfill that obligation, not all employers report this in Croatia. What we need is a better oversight of whether regulations are applied.
I am heading to France, where the International Agency for Research on Cancer evaluates suspected agents. They classify them into 4 groups, depending on the degree of proven risks.
Group 1, which is the classification of known carcinogenicity, contains 120 substances or agents in it. And of those 120 substances, at least 70 are known to occur either currently or in the past within the workplace. And so it's been really important for countries and international organizations to take steps to reduce exposure in the workplace.
In Bilbao, I was told the EU has already done a lot when it comes to regulations. That is according to the EU OSHA Executive Director, Krista Sedlacek.
Now they amended the directive on carcinogens and mutagens. Now we have 26 substances causing cancer, and we have occupational exposure limits for these 26 substances. By using these exposure limits, we could avoid the death of 100,000 of people.
Mr. Dlajic, what sectors are posing the bigger danger to workers?
For example, welding is one of the issues because there the carcinogens are generated during a process. But we have also sectors like the nurses in the healthcare sector. They are exposed to carcinogens, and also the hairdresser, because using the chemicals for whatever they do with the hair, they are partly including carcinogens. And don't forget the construction sector, because maintenance of building is also of high risk because of asbestos or silica dust.
Are large companies with larger infrastructure better set to give an example, to show preventive measures when it comes to occupational health and occupational cancer?
Several surveys and also research clearly indicate that larger companies have a more systematic approach to occupational safety and health, whereas micro and small enterprises do not have a systematic or holistic approach, so they are more reacting on an ad hoc basis. We, EU OSHA, have developed one tool. It's an online interactive risk assessment tool called EURA, which provides assistance to micro and small enterprises. It's web-based, it's without any cost, easy access, and of course, you get by that way, using this tool, a very good risk assessment.
And we have asked you to bring a real object to illustrate the topic.
Yes.
What is this?
This is the so-called house of workability. You can see there are 4 pillars or 4 levels, very important for improving the workability of people. That's health. It's the basis. We have to see competencies and talents, also values and work, of course.
And with all these components and all these elements, health comes as the basis of all of that.
That's the basis of all.
Thank you very much for the interview, and thank you for watching, and we see you soon.